My project is about the optimal tissue activation during deep brain stimulation of the thalamus in patients with essential tremor. Essential tremor, or ET, is a neurological movement disorder that primarily manifests in the hands, but can surface as tremor in other extremities as well. Deep brain stimulation, or DBS, is a surgical technique available to ET patients involving implanted electrodes stimulating local tissue. The traditional target for ET DBS is the thalamus, or more specifically, the ventral intermediate nucleus, a gray matter structure visualized in blue in Figure 1. However, recent studies suggest nearby white matter tracts, such as the dentatorubro-thalamic tract, are more effective stimulation targets for reducing tremor. I seek to answer the question, is more white matter tissue activation associated with good therapeutic outcomes or bad side effect outcomes? Available for analysis were postoperative data on 18 ET patients. From their clinical diffusion tensor imaging scans, metrics called mean diffusivity, or MD, and fractional anisotropy, or FA, were calculated for all voxels, essentially 3D pixels, in the brain. These metrics are represented in Figure 2 as glyphs, which correlate to water diffusion in various tissue types found in the brain. Figure 3 shows heat maps of MD and FA values in an exemplar patient's brain as viewed from a coronal slice, with hotter regions correlating to higher MD and FA values. Machine learning algorithms were trained on a separate dataset of Parkinson's disease patients in order to classify voxels based on their MD and FA values. The results of that classification are shown in Figure 4. Table 1 summarizes the percent accuracy of a few algorithms. For my purposes, the K-means algorithm performed best with 92.2% white matter accuracy and was used for subsequent segmentation of all 18 ET patients. With the now classified white matter tissue, I correlated stimulation voltage with percent white matter activation within the volume of tissue activated, or VTA, for only therapeutic VTAs. I found no trend, which is a promising result. This implies that as the VTA increases in size, the percentage of white matter activation does not vary, ultimately indicating that white matter is a common denominator among therapeutic VTAs. In further analysis, I will include all patient outcomes and VTAs, not just therapeutic ones. Once these new patient outcomes are included, results of non-therapeutic statistical analysis can be interpreted in tandem with therapeutic results, showing any possible significant findings.